What we're going to talk about tonight is how to optimizing cosmetic dentistry processes within healthcare payment solutions. So my goal on this deck is just to walk you through what's out there, what we're seeing in the industry. I know I was already introduced, but just a little bit more about me. I've been doing this for 13 years at this point, almost 13 years, exclusively in the dental field, ranging from one DDS, one operatory, through some of the largest corporate entities in the country. We've seen a huge change in technology and dental payments in the last 12, 13 years. I think we can all agree on that. So I am pretty excited to walk through what we're seeing. I'm kind of stealing my own thunder here. But what we are going to discuss is payment options, make financing more manageable for the practice and the patient, digital tools which are proven to enhance patient experience, automate workflows, and technology implementation and how easy it is to implement some of these new technologies. So when we think about cosmetic dentistry is actually one of the most rapidly growing sectors within the dental sphere. We've seen a massive increase of number of visits over the last 16 to 24 months, which, interesting enough, goes against what we thought once COVID and the global pandemic started in March of 2020. The American Academy of Cosmetic Dentistry actually found that the United States alone, annual spend on cosmetic dentistry is almost $3 billion, 2.75 to be exact, which is just a very large piece of the pie. NBC recently reported that some cosmetic dental practices have seen nearly 50% increase for teeth whitening alone since so far in 2021. So the high demand and broad patient base that is out there for cosmetic dentistry should make most offices thrive. However, that isn't always the case. And the issue of payments has posed a massive challenge for not only the patients, but also the providers as well. So the same goes for the staff, where they struggle to collect payment in full or aren't getting the full amount of the procedure at the time of treatment. Healthcare payment solutions and technology in general can help in giving patients the flexibility and convenience to afford cosmetic procedures while making it easier for dental practices to get paid for the services rendered. The technology will actually increase patient satisfaction and reduce staff workload or redundancy. So through this presentation, I'm going to discuss how to identify and recognize the payment solutions, how to prioritize finding the right technology partner, and how to adapt these tools. I will share firsthand experience of what we see in the industry, some good feedback from existing providers using this technology. So the main topic, our first topic we want to discuss is how digital payment tools enhance the cosmetic dentistry experience. Patient experience is foremost on everyone's mind in today's environment. And I'm going to talk a lot about that and stats to back that up as I go. But the dental industry leads with cutting industry clinical technology. I don't think anyone would refute that. But in most practices throughout the country, the front office workflows and revenue cycle technology lags way behind, really about 5 to 7 years on average. This can happen for several reasons. Mainly, priorities are what's happening in the clinic, right? Patient safety, et cetera, and that's perfectly fine. However, most times, and a vast majority of times, what we see is that a lot of providers say, I've had this forever, it works. If it's not broke, don't fix it type of mentality. We've heard that the adoption rate or the fear of adoption rate by not only staff but patients as well is another limiting factor of why don't we have this technology today. But while most practices can get away with the status quo, they miss out on the plethora of benefits that enhanced technology provide a provider, such as strength of patient loyalty, which is critical, and healthier cash flow to the bottom line. So let's think about what a common outdated front office interaction looks like for a patient today. I walk in, I sit in the waiting room, I get handed a clipboard. It's paper. I fill that in. I don't know my group number versus my member number on my insurance card. I have to fill something out again. Then I make a payment, maybe a partial, maybe a full, but most likely a partial payment. Post adjudication, I get a bill in the mail 30 to 60 days later. I don't know why it's there, and I have no way to make that payment. None of that is efficient, and none of that is what consumers want in today's environment. On the same exact side, the staff has to deal with all that paper. They have to do the manual entry. They have to read my illegible handwriting. They have to call the patient. They have to go through the billing process, which most providers we talk to is the least favorite part of their job, and that's a good reason for that. So what we want to do is bring patient preference and patient statistics to the forefront. So in recent consumer studies that we polled patients on healthcare preferences and payment experience in 2020, we found the following patient preferences above that support the desire to move to a digital experience. Patients want the same consumer experience from their healthcare providers that they get in every other aspect of their daily life. Amazon, for example. You might hear me say that once or twice because everyone understands that. But what we see on that is convenient digital payment options, data entry, communication, ease of access. All of these are available and could be brought to life, and statistics show that consumers, patients, want these functionalities within their dental practice. We as consumers, as we make a payment for anything, again, in retail or in any aspect of our life, we all pay with what? This phone here. We all have our phones on us at all times. So why can't we do that in every healthcare practice we walk in? Why can't I provide you a card on file before I come to the practice like I do at a hotel, for example? When we buy something on Amazon, they offer one-click payment. I'm in, I'm out, I have the object tomorrow or whatever it is. This is wildly adopted by every consumer in the country, and a vast majority of consumers have a smartphone today. We can enable that, or there's technology to enable that inside the dental practice. So how does dental payment solutions smooth operational efficiencies and patient satisfaction? In my opinion, technology exists to alleviate pain points between the staff and patients' workflows and experience. This stems the entire patient journey. So we're going to break it down on the next slide into three aspects: pre-care, point of care, and post-care. So before I come in the clinic, and post-adjudication. What we see is that there is a disconnect between what consumers want and what the office is offering them. So when we think about the patient experience and how technology can solve that, it's by providing flexible payment options and automating payments and having digital engagement and having digital forms and having online bill pay. The ultimate goal is to provide the patients with all forms of payment options, specifically in cosmetic surgery, as we know these are high-ticket items. We don't want a patient to balk at a $2,000 procedure and go to the next practice down the road that will say, hey, we'll split that up into two payments. We want to provide all payment options to the patient. That increases their patient or their satisfaction with the billing cycle, which inherently will make them pay faster. And then on the staff side of the world, there's technology that streamlines the staff's workflow as well. So they don't have to manually enter. They don't have to go through the redundancies, the errors that are involved with registration and payments and what have you. So we actually see an increase of patient or staff satisfaction as well. Now the patient has three main points, touch points with the practice through their payment journey, and it's pre-care, point of care, and post-care. So when we think about the patient's journey with your office and having these three stages, there are opportunities at each stage to create a positive patient experience and to open up the opportunity for patients to make a payment digitally. Technology makes all of this possible, and we'll talk about it in each one of these windows in more detail here in just a second. We want to be able to engage the patient from the moment they book an appointment. So let's kick that off with pre-care and capturing information. Patients are willing to shop, and this is the very important piece that we found over the last maybe 24 months. Patients are willing to shop around to providers who offer digital communication and registration, and for good reason, quite honestly. We all have been in the patient's position, rushing through the paperwork. We're in a hurry. We're making mistakes. We have to refill everything out again. Even if you access the forms online, which is a great step, by the way. If you have forms online, that's a great first step. The information most likely can't be entered manually or digitally, so you have to print it out. I can speak from firsthand experience here. I have a printer, it's my third one this year, that I can't get to work in my home office. So if I was to have to print something out, odds are I'm not going to be able to do it. Now I have to come in 15 minutes early. I have to sit there with a mask on in some parts of the region or the country. We want to digitize that, make it an easier back and forth, and we can do all of that on the cell phone. A recent study actually showed that 22% of self-described loyal patients would change healthcare providers if offered a better digital communication tools by a competitor. Additionally, the options to fill out forms digitally and receive an email and text notification were among the top features that influence patients' decisions to switch healthcare. I think of it as the airport. The kiosks are there and they're fine, but think of that as the clipboard. 9 out of 10 times, we're going to check in on our cell phone. We're going to have that boarding pass on our cell phone. We're going to walk straight through security. The same exact concept here. So let's talk more about digital registration. Digital registration allows you, and everything is HIPAA compliant. All these technologies are secure. There is a vetting process. Allows you to collect digital patient registration technology. Patients can send their patient electronic registration forms. They can fill out at home. They can fill out in their car. They can fill out on the train if they're in Manhattan or Chicago. The link to fill out digital forms can be shared through text, through emails, and the patient can fill out those forms electronically using their computer, tablet, smartphone, what have you. For context, let's think about what happened in March of 2020. Patients were no longer allowed to congregate in waiting rooms. And again, depending on where you are in the country, that still may be true. So these types of digital forms, touchless, contactless solutions became paramount, actually mandatory in most cases. Electronic forms no longer require the clipboard. There's no pen. There's no exchange of paper. There's no scanning anything into the pins. And it still allows the office to collect the critical information that they need, insurance, medical history, et cetera. Patients get the convenient experience of filling out these forms on any device. I think of it as how do we book a restaurant these days? We go on OpenTable and book it on our phones. It's the same premise here. This is a completely touchless option that patients are actively looking for and shopping which dentist, which cosmetic surgeon they're going to go see. Now, on the staff side of the world, think about how this will simplify their world. Instead of getting paper and not being able to read illegible handwriting, or not having the correct group number for insurance, or the patient puts their medical card instead of their dental card, which we're all familiar with, this will eliminate that entire process. The staff will get a clean PDF. The staff can automatically upload that to the PIM system, the practice management system, and it just automatically updates into the patient's ledger. They don't have to call the patient and make sure we have the right date of birth and make sure we have the right information. This has actually been shown to reduce bad claims as well by having that accurate information digitally, because everything is foolproof. Now with that, excuse me, card on file. My personal opinion and my experience in this industry, card on file is and will always be the #1 way to reduce accounts receivable, get paid faster, and streamline the patient experience. Card on file is wildly accepted in every aspect of our day-to-day life outside of our healthcare practices in most cases. Think about a gym membership. Think about Netflix. Think about Amazon. I traveled to a corporate trade show last week. My office booked that hotel, but the first thing they ask me, Brian, we need your card for incidentals. Of course, hand it right over. That is the mindset that consumers are used to and we like. So during the digital registration process, there actually is an ability to secure a card on file during the check-in, during the patient demographic piece. For cosmetic dentistry, this is critical. We want to get paid upfront. We want to capture as much payment as we can upfront before services are rendered, or have that card on file for future treatments or future upsells in the chair if we're doing any type of add-on while we're in the operatory. But card on file is upfront in a practical way so that the payment conversations for your patients start early. They know that services need to be paid before they're rendered. Card on file allows them to understand that without your staff having to specifically ask for payment. So card on file is actually shown to be a very large indicator of patient loyalty, patient satisfaction. Everything is secured, everything is tokenized, everything is compliant. What it allows your practice to do is streamline their experience. In most cosmetic procedures, it's an elective procedure. So it's fee for service, which means the patient is in there with the intent that they want to be in there. So what that means is they expect a more spa-like atmosphere, is actually what one of our clients told us. They want to come in, they want to get in the chair, they want to have their procedure done, and they want to walk out. If they ask for any teeth whitening or any of the new sonic hair airbrushes or whatever, we can upsell them and simply check them out because we have that card on file while they're still sitting in the operatory. Now, as we transition to patient communication, we want to think about pre-care is also the right time to establish effective digital communication with the patient. And pre-care is the way to do this. Digital communication is key to the overall patient relationship, and especially when it comes to creating a satisfactory payment experience for both patient and provider. Again, technology is there to not only help the patient experience, but the staff's experience as well. And with the war on talent that we're seeing out there, it's important to keep your staff happy. Offering patient-friendly technology and payment options is only part of the equation. Providers also need to make it easy and effectively communicate those options to the patient. So we can have this technology, but we need the patients to understand how to use it. So ensuring that patients know what their payment options are and when their payment is due is critical in to receiving timely payment and making patients feel in control of their role. Make it part of your office flow to talk to the patients about what the payment process looks like, why we're keeping a card on file. And with that, and utilize convenient communication tools as part of your front office technology so that you can send text messages, you can send them alerts. It's that price transparency cost track. The shift of opening up new, more direct communication methods has been a big impact on practices in today's environment. This includes improved cash flow, strengthened provider-patient relations, and of course, patient loyalty, which is really what this is all driving towards. So you're going to see a bunch of really powerful stats here on this slide. In my opinion, SMS open rate's 98%. That's staggering. We all have our text on us, we all have our phones on us at all times. So sending patients text messages in an efficient way, not an overbearing way, to communicate, because not only is it easy for the offices, but it's a high success rate of reaching the patient. Think about your year-old patients that haven't come back to see you. Well, let's send them something. Let's send them a text. Let's engage with them. Text messages are preferred over phone calls 100%, especially with the millennials and Gen X, I believe is the one below millennials, coming into the marketplace today. And many patients report that they don't even listen to voicemails. Think about how many spam calls you get for the limited warranty on your car. We don't even answer those anymore. So if I specifically don't know your number as my provider, I'm most likely not answering that phone. Conversely, if I get a text, on average, 98% of those texts are being opened. Patient communication via text and email is the future. It is here to stay. It is where the industry is going. So what does this mean for the patient and the staff? Well, it means quite a few things. So technology that allows practices to easily communicate with patients through text messages opens up an entirely new communication channel that is more direct, less time consuming, and preferred by patients. It's time consuming for practices to call the patient repeatedly, to leave the voicemail, to play phone tag, to hope they call you back. And all that time that is spent making phone calls will only continue to decrease effectiveness as more and more patients go to not answering phones altogether. If practices want to reach patients easily and reliably, they need to start communication through text messaging. Text messaging unlocks a new communication channel. It allows you to access old patients or patients that you haven't seen in 30, 60, 90, 24 months, whatever it is. And it becomes uniquely personal. And we actually pulled these examples from some of our dental offices. It doesn't have to be about payments. It doesn't have to be about you need to check in. It's, hey, come on in when you're ready. Hey, you're in operatory 3. Hey, don't forget to wear your mask. Hey, you forgot your sunglasses. Whatever it might be, it becomes a much more personal relationship. So you can keep that feel of patients hanging out in the waiting room like they used to 5, 10 years ago, and having that personal relationship. We can do that digitally now, so it maintains that patient-provider relationship. Now, as we transition to point-of-care payments, this is the time of care that the practice can really make a convenient checkout process and encourage payment by offering the latest technology, like contactless payments, for example. Despite, especially cosmetics, offering world-class dental care, many offices are still behind offering the latest technology, quite honestly. Patients do want that retail-like payment experience, and COVID-19 has only strengthened that preference for convenient and contactless options. To create that experience for patients, offering a simple piece of hardware that accepts things like Apple Pay, Google Wallet, you can pay with your watch, tap to pay, which you can literally just put your credit card over the device and it reads it. That is all widely available for dental practices today. In addition to accepting those wide range of payments, you also want to find technology options that automatically post these payments back into the dental practice management system. So yes, we want to make sure the patients have what they need, but we also want to reduce staff overload or redundancy by automatically posting payments to the PM system. The goal is to make for a convenient and touchless checkout process for your patients. And one of the easiest ways to do that is by providing things like Apple Pay. This is a very easy transition because consumers, when we go to Home Depot or we go to Walmart, we know these units. We're used to them. We've used them a million times. So it's easy for the staff and it's easy for the patients to adopt these card readers and get more in tune with that contactless, paper-free checkout process that is normal in the retail world. In addition to that, accepting wider range of payments, you also want to find a technology option that provides all of it, including things like recurring payments and card on file, which I'm going to touch on. Now, one immediately impactful function that any provider can offer today is online bill pay. So let's think about post-adjudication balances left over. Now, of course, in cosmetics, fee-for-service, RARs are probably 1, 2, 5, maybe 8, 10%. We're doing it right in cosmetics. There's no doubt about it. We're getting paid up front. But inevitably, there's going to be those patients that, I forgot my credit card today, or I can't pay. Can I pay you half? So we have to go to insurance, or there is insurance cases, or what have you, and there's a balance left over. It doesn't have to be insurance. Think about when that patient is trying to make that payment. I will use my wife as an example, actually. We got a bill last week for $14. We opened that bill at 9 at night after dinner, after, watching our show. We're opening the mail. There was no way for me to make that payment. So what happens is we forget about it because I'm not going to write a check. I don't even have checks. I'm not going to write my credit card number on a piece of paper and mail it back. And I'm not going to call during business hours because we're working as well. So it becomes a cat and mouse game. I want to pay, but I didn't have the option to make the payment the way I wanted to. So by offering an online payment option, a simple click Pay Now button on your website, it opens you up to 24-hour revenue cycle management and revenue cycle collection. It actually becomes an extension of your marketing arm within your practices. So when we put content on your site, or when putting content on your site, I should say, think like your patient would and consider that they would what they want to do and what they care about. 91.5% of web traffic goes to the first page, your home page. 75% of people never scroll past the first page. It's staggering. So we want to make sure that one-click payment is front and center on your main page. Click, pay, move on. So on top of that, like online payments, text-to-pay is absolutely exploding. Text-to-pay is going to take over online bill pay, in my personal opinion and professional opinion. But text-to-pay technology is another way that we can access and give the patients what they're looking for. Going back to open rates, 98% of texts are open. So we know if I text Brian his balance due, he's going to open that text message. Inside of that text message is all custom branded. There's really some cool stuff on the market today. But take that a step further for cosmetic. What if we text out a payment link for a deposit for the procedure coming up next week? Then we text out another link to take another deposit day of. What if we text out just a option to store a card on file, saying in preparation for our $3,000 veneers, we require card on file. These are all secured. They are all available in the industry, and the adoption rate through, especially in the cosmetic world, is on the rise. So text to pay and text options and text card on file is the way the industry is progressing. Now, another really cool function is patient financing. So when we think about patient financing, this goes beyond the normal ways of making a payment. So technology also exists to make it more manageable for the patients to pay for out-of-pocket costs and effective procedures or elective procedures, which is obviously very important in cosmetic dentistry. Many patient financing options exist that involve lines of credit, interest, third-party collections, which are fine and quite honestly probably necessary. But built-in patient financing technology keeps the payment relationship between provider and patient. Cosmetic dentists can use automated payment plan technology in-house to make it easier for patients to pay and to encourage patients to elect treatments that they might not otherwise be able to afford, and they might not necessarily want another line of credit. Third-party options are great. Again, it's necessary. But in most cases, specifically in cosmetics, the patients want to use their credit card. I have a credit card that I picked specifically because it fits what I do and where I spend my money. I want the flyer miles. I want the cash back. That is how patients are thinking about financing today. So you might be hearing this term a lot, care now, pay later. I think it's a great term. Payment plan technology can link to debit cards, FSA, HSA, credit cards, of course, and it gives providers a practical solution for working with patients who are unable to, or prefer really not to, make a lump sum payment. Offering patients the ability to make an initial smaller payment increases your likelihood of, one, ultimately collecting the full amount, but two, maintaining that patient in your practice. Because like I said earlier, they are actively shopping who is offering this technology. A very popular saying is a third, a third, and a third, right? I'm sure we've all heard that. A third now, a third the week of, and a third a day of. Well, we can automate that, or the technology can automate that. So payment plans are being offered to help patients make payments manageable and can incent patients to start treatment earlier than they might have before. Using technology with built-in payment capabilities mean that providers can offer these payment plans without having to track the cards on file or the payment plans themselves. Think of Netflix. Netflix never sends a statement. They automatically generate our credit cards, and that's it. They also go out and update our credit cards when they expire. All of that technology is available for the dental organizations. So we spoke with Casey Jones, who's an office manager of Dr. Thunberg and Associates, a 3-generation dental practice in Illinois, about the practice's recent technology transformation. And what we found is that offering automated payment plans has freed up a significant amount of her time. So when we think about scalability and FTE hour reduction, this is what we're talking about. She explained how to follow up a lot of 90-day balances with patients on payment plans. Of course, we have payment plans. I'll send you a check every month. We're always about 3 to 4 months behind. However, she said that patients, they now just pay once a month because it's all automated. They don't longer skip 2 months in between. She also said that, hey, we didn't get up to our 2 monthly payments, and they could edit the payment plans inside of the technology. Once she was able to get them on the monthly payment plan, she didn't have to worry about calling them anymore. She didn't have to worry about chasing them down. She didn't have to worry about ruining relationships. Technology is there to alleviate that awkward conversation around outstanding balances, which inevitably leads to better patient loyalty. So the pre-care, point-of-care, and post-care technology that we've been discussing have a few important things in common that apply to the success of all dental practices. The first is that they create a digital patient-first experience that patients are looking for in their providers to provide. Patients have no shortage of options when it comes to their dental care, and they are willing to shop around to find the experience they want and are willing to leave an established practice to go there. Our consumer study illuminated the fact that these digital options, such as digital communication and payment methods, are no longer nice to have, they're must-have. They are key factors that make a patient either more loyal to a provider or that send patients looking for another practice. Technology is proven to improve patient satisfaction and patient loyalty. So how do we create efficiency? Well, technology solutions for digital registration, patient communication, and payment also all work together to create an efficient front office. They complete a circle, let's say, complete the patient journey. Digital technology is faster, it's easier to manage, and it can interface with all practice management systems in the market. So this automates the processes, it saves staff time and effort, and with saved staff time and effort from tedious manual process, your staff can focus on really the important thing, and that's the patient care that we're providing at healthcare offices. So let's dive into automation a little bit more. So all of these technologies are great. They're out there, we should be using them. But with more payments coming in, it becomes imperative, if you're going to invest in technology, to invest in the right technology, in a revenue cycle tool that will interface with your practice management system. This will automatically post the payments, automatically update ledgers, etc. Having an automatic way to sync payments between systems also removes the possibility of manual error, ultimately meaning more accurate reconciliation, more accurate reporting, more accurate batch reports on your bank statements, and most importantly, it keeps the patient ledger up to date, which keeps the patient happy. So let's talk about some of the challenges to new technology. Despite the clear pain points and vast benefits that we just laid out in the first two-thirds of this presentation, we also hear a lot of, we're not sure we can take this on right now, or our staff wouldn't adopt to it, or our patients wouldn't adopt to it. And I'm going to walk through that. Yes, we can, and it's quite easy. So the first step to implementing technology is to identify the root of your practice cash flow problem and points of friction between patients and then reaching the technology options that are available to you. When making a list of what would most benefit your practice, don't settle. You don't have to piecemeal it together. Look for a tool that will solve all aspects of your front office payment issues. Listen to your team's input. Dr. Thunberg said, quote, "For me to give up the old ways of the administrative aspects of our practice was tough because it's always worked." That's where I think you hire excellent administrative staff for your reception and front office, and you trust them. And at that point, that's where the technology kicks in. So when choosing a vendor, finding the right time for the new technology implementation, at a busy dental practice, there's never really a right time. But setting your group up for revenue cycle success outweighs any inconvenience they might have. Many times practices reflect on the payoff saying, the only thing I wish I'd done is have this sooner. Beyond the solution itself, take time to learn about the implementation process and the level of support that the technology vendor provides with setup, troubleshooting, training, ongoing support. The right technology provider will come alongside your organization and become a partner, not a vendor. That is critical when talking to any software company, to make sure they are a partner and not just a vendor. So implementation hurdles. Probably the biggest thing we just hear in the market today is, we don't have staff capacity to do this. So even if your group or practice has identified a clear need, and there's always a need to clean up or enhance technology, it's common for the process to get pushed aside because, like we said earlier, we're concentrating on other things. There is a point where we do have to make technology paramount or forefront in the process, because once you implement the technology, the ROI becomes exponentially higher because we're reducing AR, reducing SPE hours, we're reducing the statements going out. So really Really the key during the implementation process is to make it a priority. And with that, we need a clear communication plan. So when you begin working with a technology vendor, work together to come up with an implementation plan based on your bandwidth. You don't need to implement texting, card on file, or recurring payments, online bill pay in one day. That's too much. Do it in waves, do it in a process. One best practice that was shared with us is that making the transition like I said, consider splitting up into smaller phases and by staff member. Split the staff into manageable groups. This allows time for training during the trainings to have intimate questions, intimate workflow back and forth. How can this help us? So when we think about implementation, let's pinpoint the problem. Let's find the right vendor or partner. Let's prioritize the implementation because a lot of this is very easy to implement. And then let's have a clear communication plan to your staff. It is the staff that needs to buy in for this to be successful. So just to wrap it up, what the global pandemic accelerated in healthcare's digital transformation as the industry moves towards the embrace of completely digital models. It is certainly felt that we're already headed this way. COVID completely sped it up. Text-to-pay's been around, wasn't widely used until March of 2020, for example. We encourage you now to leverage new technology that will take your practice to the next level, not only in revenue, but patient satisfaction, patient adoption, and lower days in AR. Use digital or electronic patient registration forms to collect as much data or information, including card on file, from your patients before their visit. Adopt text messaging communication. Shoot them a text, talk to them via text, allow them to pay via text. Offer basic things like Apple Pay. Apple Pay is skyrocketing with the millennial generation. So there doesn't have to be any touch points in the practice. And then especially important for cosmetic dentistry practices, offer those flexible payment options in-house. Always have those third line of credits. Those are great to have, but offer a patient a free installment plan before a procedure is scheduled. So just to wrap it up, one more thing, I'll leave you with this reminder of the technology that each individual dental practice should leverage to reach new levels of profitability and efficiency and patient care and satisfaction as you soon once again reach pre-pandemic levels of appointments. So I wish you all the continued success. I want to thank you all very much for the time.